It took me 18 years to get to that very end of my rope where I said, I can't keep doing this. It's killing me. Boy, it would have been nice if 10 years ago I had gotten to that point. But what I would say to people right now is, if you're really unhappy with what you're doing, there's alternatives. Life is way too short and it is not guaranteed. None of us are guaranteed tomorrow. And I didn't want to live another day where I was regretting or worrying that, that I didn't like what I was doing. I was stressed to the max, and that is just not the case anymore at all.
All right, welcome to the Medical Entrepreneur Podcast. We have a very special guest with us, Dr. Gayle King, who practices in Aspen, Colorado. Gayle, can you tell us a little bit more about your practice and your journey to your practice?
Yeah, actually, it's quite a long one, and we'll try to keep it a little bit shorter. I am a former GYN surgeon. I have been in Aspen for 21 years, and 3 years ago, I changed my practice from a surgical practice to a concierge medicine practice, and now I focus on longevity medicine.
Excellent. And then what do you feel like is your the transition from going from mainstream medicine to going into longevity medicine? Can you tell us a little bit more about that? And, for a lot of doctors that are currently in mainstream medicine, it's very scary to even consider that.
Yeah, my choice to make the decision to go into concierge medicine was something I talked and thought about for probably at least 10 years. The thing that really set me up for success was I did a fellowship from A4M in anti-aging and regenerative medicine back in 2012. And I did their fellowship program, and I am board certified by them. So when it came time for me to make a decision of how am I going to change my practice to be a better fit for me personally, and also my patients, I already had that background that I could change to. So one of the things that I could recommend to other physicians who are, maybe dissatisfied with the way their practice is going or finding that it's just very stressful, which is what I found for my practice, is have a backup plan already. It never hurts to have that extra education. And my experience with other doctors and practitioners who've done extra education like this is it stemmed out of a personal experience. In my case, it was my mom who got critically ill. She ended up having cancer. And at the end of her cancer treatment, her oncologist basically said, "You're cured, goodbye." And we were really left flabbergasted because she couldn't get out of bed. She had a feeding tube in, and they literally were swishing us out the door saying, "Go figure this out for yourself. You no longer have cancer," which is fabulous. But they really left us with no guidance as to how to get her life back. And that was the impetus for me to say, hey, there's got to be more out there than what I know and what I was taught in medical school. And that's when I found A4M and did that fellowship. So that is something I would highly recommend to other doctors is get that extra education, because if you're wanting to go into a concierge or a more focused practice, you need something that you're offering. It's a lot of doctors who are, say, internal medicine doctors are going with some of the big medicine concierge practices. MD VIP, for example, is one of them. And there is a doctor in my area who went that route, but he's really not doing anything different. He's just an internal medicine doctor who's still doing internal medicine. And as best I can tell, his practice really hasn't changed that much. His life hasn't changed that much. He's still as busy as he was. And it sounds like it's still difficult for patients to get in with him. So by me having that education, when it came time to make the transition, I really was able to just step from one practice truly into another one because I already had the education going into it. And it was just a matter of the logistics of making the practice change.
I think that's so true. And so many times as physicians, we're always looking for someone else to give us the answers. Like, for example, that MD VIP, I don't know much about it, but, I see all the time where there's franchises that, offer, hey, we're going to change everything for you. And people forget, they're in the business of making money too, of course. So they've got to be there. And ultimately, I think really as physicians, the main thing I see, and I'd love to get your opinion on this, is that the patients are looking for something different. They're not looking for big pharma anymore. They're not looking for pills anymore. They're looking for solutions to the actual problems. They're looking for somebody who can actually listen, and even somebody who can diagnose things in a different way, you know?
Yeah, very, very, very true. My patient population, I'm very lucky. I was in Aspen for 18 years before I made this transition. And so I already had a very established practice. In fact, I had a very full GYN practice. To be completely honest, I actually felt very guilty about making this transition because I thought if I quit doing what I'm doing, there's nobody else in the area that does what I do. But it came down to my health. In the end, my health was suffering just because of the stress of the practice. And I went looking for, there's got to be a better way for me. And I knew that just mainstream medicine wasn't working for me. So why would it work for my patients? So definitely that. And with some of the other corporate practices, you're right. They take a very hefty commission. In fact, I believe it's 50% of their patients' membership fee goes to that corporation. And now you're practicing medicine, but you're still beholden to a board of directors and things like that. Whereas my practice is completely private, and I really get full say of what do I do, what do I want the direction of my practice to be.
I think that's the way it has to be, because ultimately there's never going to be someone who, knows as much as you, and ultimately, like, it's your responsibility to take care of the patient. And anytime you put someone above you that's going to tell you what you're allowed to do, it's always a mistake,
Yeah.
I mean, that's how medicine got so corrupted in the first place,
Right. I think the other thing that I really found is in my practice before, we always did allow a little extra time. A typical GYN exam lasts about 15 minutes. We always allowed 30 minutes to an hour. But that became an issue because, again, you can't charge insurance more for that same exam, even though we were giving patients a little bit more individualized care. Now there's none of that. The insurance is completely out of the picture. I don't have to ask insurance whether I can do an ultrasound at my patient's annual exams. Everything is included in that membership that I do, and insurance has literally no say over me. There was a point in the past where I had approached my local hospital about possibly purchasing my practice, and the best thing that could happen was they said no. And, at the time I was a little bit disappointed, but now I'm like, oh, thank goodness that they did say no, because I wouldn't be where I'm at now had they done that. In fact, I'm not even sure I'd be in Aspen had that happened.
Wow. Man. And the other thing you kind of mentioned was that I feel like a lot of physicians, when we struggle with, is kind of like a martyr syndrome, where, like you were saying, the insurance didn't make sense. It was literally hurting your health, but yet you still feel like you needed to continue to serve, despite the fact that, these insurance companies, I mean, you can just look at their books, that 51 cents of every healthcare doctor goes to administration of healthcare. I mean, it doesn't even make logical sense. Like, you don't see that with any other business, but, but yet, here we are, physicians. And I think a lot of people take advantage, like the insurance companies take advantage of that. I think the government takes advantage of that. Do you feel like, now that you've kind of made the transition, do you feel like that you were able to provide a higher level of service and your patients are happier?
No doubt about that at all. Number one, a typical appointment now is a minimum of an hour. When we're dealing with complex situations, it's not uncommon for me to have a 2-hour appointment with patients. We do try to accommodate my members with appointments as quickly as possible. And certainly if it's an emergency, I'm going to find some way to see them that day, no matter what. But yeah, my time is dictated by what does the situation demand, not, hey, I have to see so many people in a day just so I can keep my doors open. None of that is even a factor anymore.
Man, that's such a change. And just like that, I remember, when I took insurance, people would come in, you have your little, scheduled time with them, and they would come in with like 10 different problems, and it's like, there's no way you could even address that. So you have to have them come back. It doesn't make, sense. And then dealing with the insurance company, just I realized the more that I look back on it, just what a disservice it is to the patients and their healthcare.
In fact, I found it out the hard way. I had a patient one time who had come in for an annual exam, and during her exam, I found a mole on her back that I really thought was melanoma. And I'm like, you're not leaving my office without me removing this mole and sending it in. And because I did it on the same day as her annual, her insurance company refused to pay both for her annual and for the mole removal. Thank goodness it ended up not being melanoma, but that was when I realized, I really don't have autonomy here and to do what's best for this patient. I looked at it, I was very concerned that it was something super dangerous. And I wanted to do right by that patient and, got punished for doing the right thing.
Exactly. And so, what would you say to anyone who's out there who's maybe considering the leap to starting their own practice? Is there any things that you would know now that you've completed it that you wish you had known before you started?
Well, there's a couple of things that happened in the beginning before I made the transition that were super helpful. I was approached by a couple of concierge groups. So again, these are corporate groups that help you go concierge. And one of them was able to take my patient database and run an analysis on it. And they were able to tell me how many patients did I have in my current database who might be able to afford a concierge membership. And their membership prices were considerably less than what I actually charge now. But once I had that information and found that it turned out to be like 73% of my patient population could afford to be a concierge member. And they were willing to do some work for you up front. If you decided to go with them, they were going to help you send out the letters, the newsletters, and even talk to patients about what is a concierge membership. Once I had the information that, wow, a lot of my patients could afford this, I ended up not deciding to go with that practice. But, they do offer this as a service, and it was free to me. And it was just really beneficial to know that, because it took the guesswork out of, am I going to fail? If they'd said only 1% of my patients could afford it, maybe I wasn't, something that I could take the leap. But knowing that basically 75% of my patients could afford it, then it came down to, did they want it? Did they find it of value? It's been right at 3 years now since I went to this new practice model. And my practice now is actually currently full. My membership base is full. I always make exceptions for, generally somebody come to me, just like you said, they'll have a family member who is having a really difficult time. And it's classic that they've been to 5 or 10 different doctors and nobody can figure it out, or they just don't feel like they're being listened to. And they'll just come and say, please, would you mind seeing my dad or my mom or my sister? And I generally will make exceptions for that. But in the span of 3 years, I went from 100% insurance to 0% insurance and to a completely full concierge-based practice.
Man, that's amazing. And then, now you're really starting to get well known to be the regenerative medicine doctor in Aspen. Can you tell us a couple, just some examples of some patients you treated and kind of maybe some case studies, or stories for another doctor who's maybe interested?
Yeah, there's actually a couple of them that don't necessarily have to do with regenerative medicine, and I definitely want to get into that in just a bit. But I think some of the patients that I can think of where it was truly life-altering. I had a patient come to me who basically was weak and felt horrible and had been to 20 different doctors. And the first thing that I did was take a history. And I found out that she had been on an acid blocker for 20 years. And so I immediately thought, wow, she's probably not digesting and absorbing her food. So we did a vitamin test on her and found that she had 0 nutrients in her body. And we gave her a Myers IV that day that we got the results back, and she came back the next week already feeling better. So to go from something that I now think is so commonplace and that somebody else should have picked up on the fact that, maybe being on an acid blocker for 20 years is not a good idea. They're FDA approved for 6 weeks. But nobody had even asked her that, and she'd been to so many different doctors, and nobody was really taking a big look at the total picture of her as a human being and everything that was going on. And she's still my patient to this day and is still getting IVs, but has come to me for other things as well. Now she sees me for regenerative medicine. Another patient that I can think of, just off the bat, my practice focusing on longevity. When I bring people in for their onboarding, we talk a lot about the advanced testing that I offer. And one of the big things that I push every single patient to do is get tested for toxicity. Every patient I've ever tested in my entire practice is toxic. It's just a matter of what do they have, how much of it, and how are we going to get rid of it. I had a patient who was not feeling well at all. And this was sort of unusual for her. She had been in my practice for quite some time and had been doing detoxification IVs for years. But because of the sudden change that she didn't feel well, we repeated her toxicity test and everything came back negative except for her tox detect, which was looking at plastics and persistent organic pollutants, volatile organic compounds, things like that. And it came back positive for really high levels of 5 different plasticizers. And I looked at her and I said, this is current exposure. This, everything else is, we've gotten rid of everything over the course of time. You're being exposed to this. And she kept insisting, I don't have any plastic in my house. I don't use plastic baggies. There's no plastic. I'm not being exposed to it. And I kept being insistent. I said, look, you're being exposed. We just got to figure out what it is. Finally, it dawned on her that she'd been having back pain and she was using Salon Pause pain patches. They're patches that you stick to your back. And when we looked it up, sure enough, it has all those different plasticizers in there in the elastic of the patch. And she was putting 5 of these patches on herself a day. So no wonder she was toxic. She stopped using the patches and within a week her symptoms were gone. So,
Isn't that incredible?
Being able to kind of be that detective, but also knowing that she had already done everything properly to get herself detoxified from all the other substances like glyphosate, mold, heavy metals. And we were able to say with confidence, look, this is current exposure. And then it was detective work from there on in. These are things that let you go home at night and think, wow, I literally changed that person's life. And I mean, there's really nothing better than that.
Man, I would agree with that 100%. Like since I started doing concierge, you can spend so much more time figuring out the problem, which is just literally impossible with mainstream medicine. You don't get paid for it. You don't get paid to think at all in mainstream medicine. That's part of the issue, and so there's no time that you ever get paid to sit down and figure out what's going on. And all these things are very solvable, but it's just like you said, you have to understand hey, there's tests that you can order and all this stuff for most doctors has been somewhat hidden. And my goal is to teach as many doctors as we can that are interested, at least, to know that hey, there's other stuff out there that you can do, just like microplastics. It's a major problem, as you described. I mean, how many people are taking some kind of topical patch that's full of plasticizers and just like that, like Salon patch? She thought it was a medicine helping her. Maybe she was even prescribed it by someone. I don't know.
Yeah, she had gotten that one over the counter, but again, it made me even rethink what I'm putting in my body, and I definitely have went through my personal care products. I actually don't use any topical lotions or anything like that. Thank goodness I don't need them, but I cut out all of that because I just started thinking, your skin is one of the largest organs in your body. It's incredibly good at absorbing things. And I certainly didn't want it to be absorbing things like that. And now I almost panic if I were to think, oh gosh, I have to put something like that on me. And basically, I'm not going to do it. It's altered how I change what I do in my own personal life as well.
Man, that's a great one. Any other examples you want to share?
Well, getting into regenerative medicine, back in 2012 is really when I started down the pathway of thinking we as humans are meant to heal. Our bodies have this innate capacity to heal, but we are putting a lot of roadblocks in front of that. What can we do to take away those roadblocks, but also what can we do to augment it so that our body can heal itself? And that's really where I see regenerative medicine is augmenting your body's ability to do what it's innately meant to do. So I was doing stem cell therapy back in 2012. And at that time, doing autologous stem cells, you had to, and still actually today, really what is legal in the US is harvesting from somebody either via fat or bone marrow, minimally processing it, and then re-injecting that in the same day. And in my practice, we were doing bone marrow aspirations from the iliac crest. And it's not necessarily a comfortable procedure. I wouldn't say it's horrible. I've had it done myself, and it's definitely uncomfortable. It felt like I had fallen on the ski slope really good the day before and had a really good bruise back there. But I think back, that's now 13 years ago, and what we were doing then versus what we have available to us now that is just magnified 100-fold. And we now no longer have to do those invasive procedures. All we're doing is giving a product. And the product that I really use now is the PDPA, the placental-derived protein arrays. And I'm able to do injections into joints. We do a lot of IV therapy with this regenerative product because it can cross into the blood-brain barrier. And we are seeing, just it taking inflammation away. It's working for autoimmune diseases. I have patients who have Crohn's, for example, who are getting benefits from the IV therapy itself. And then, needless to say, the joint injections have been miraculous. Patients having tremendous success, myself included. I had my knee injected, and within 3 days, the swelling was gone, the pain was gone, and it's like I never had anything wrong with it. So really loving this as a new option.
It's amazing technology, and I think technology just continues to improve. But what I think is really cool is that there's so many people out there that are looking for these things, and they don't. What I see from the patient side, I'm not sure if you see the same thing, is that they don't even know where to go. And so there's kind of like a lot of misinformation out there for patients, and it's very confusing. Like, where do I go to get, regenerative or stem cell therapy, And so just, being able to help your patients and guide them along and recommend like truly effective options versus, hey, this is, some, third party product that, may or may not be good. I think is really important. So.
Well, what's interesting, though, is that I'm having patients come to me right now and they're saying, I went to my orthopedic doctor and they're recommending that I get a PRP injection, a platelet-rich plasma injection. And I'm like, yeah, I was doing that 13 years ago. I'm saying, I'm not saying that it's a bad idea, but, what we have today is so much more advanced. I think that it comes down to what tools do you have in your toolbox? And if you're a traditionally practicing orthopedic doctor today, they are restricted as to what they're using. And PRP is, state of the art to them. And I'm like, yeah, that's something we did 13 years ago. And the reason I don't do it today is because I think it's just not as good as what we have. The other thing is the product that we're using, we are using it under research protocols, but it is legal. I have patients who have come to me and they've gone to other physicians and had stem cell injections. And it was sort of a wink, wink, I got this somewhere. And it's actually not legal to inject in the United States. And I'm like, I'm not willing to risk my medical license for that. This was a long journey getting through medical school, getting to where I am right now. And I'm certainly not going to risk that in any way by doing something against the law. And, I take deep breaths in when I hear this because, because we know that they're doing this under the table, the question is, where are they actually getting the product? What actually are they injecting? And, and unfortunately, patients are going there because they think that's their only option other than, the traditional route, whether it's a total joint, which, from what the newer in longevity medicine, what the newer mantra is number one, don't die of something stupid. Number two, keep yourself as healthy as possible. But number three, don't get a joint replacement because within 10 years, we'll be able to regrow joints completely. And so what we're doing is making it possible for people not to have to go down that joint replacement pathway. And even people who have pretty severe pathology, stage 3, 4 arthritis, we can at least get them through until maybe something down the road where they can actually regrow a joint. But so many of them are getting such good pain relief from it. They're like, why would I undergo a joint replacement when I can get relief from this, even if I have to come back and have another injection?
Absolutely. I think one of the most important things that is out there, and a lot of people are just not aware of it, is if you really go into the journals and the science, we understand very clearly like the immunohistochemistry of exactly how arthritis occurs and each stage of arthritis, exactly what cytokines, growth factors, microRNA changes are happening. So it makes sense that if you're able to understand what's occurring and you're able to basically combat that or you basically, use alternative, cytokines, growth factors, microRNA to essentially change that state, that you can halt arthritis and even reverse it. Yeah. I mean, and I'm sure you have the same thing, but like I have x-rays of people who've gone from stage 4 to stage 2, people from stage 3 to stage 1, like you name it. And the thing is, it's almost like a hidden mystery, but yet at the same time, there's been, decades of clinical studies published on like exactly how arthritis works, exactly what's going on. And it's just, it hasn't become into what we consider mainstream medicine. One is because, the payers are not interested in paying for anything. But then two, there's a lot of manipulation by large corporations that are interested in, medications and surgery for people. And, there's a lot of incentives for that.
Yeah, they're making a lot of money. The manufacturers are making a lot of money on those joint replacements, but they also, if you have arthritis, they really would love to have you chronically on a medication for the rest of your life. And, my goal with my patients is I don't want you on medications. I may want you on supplements. I may want you on hormones. I may want you on things that are here to help you. But, my goal is to get you off as many of your medications as possible, whereas their goal is to get you on as many as possible and keep you on, and then deal with the, polypharma problems that you're having. One is causing one problem, so you go on another medication to treat that other problem. If we can just get you off of those and get your body back functioning the way that it was meant to be, that's really what this is about.
100%. And I think that's the biggest issue that a lot of doctors have, is that they become essentially, their algorithms are running are basically big pharma algorithms. Oh, you got this problem, this is this pill. Versus saying like, hang on, the pill is a Band-Aid, is covering up the symptoms, but why does the person get the problem in the first part? And 100%. What can we do to reverse that? Yeah. And it's just amazing, because as soon as patients see that, that's exactly what they want. I mean, I don't know if you see the same thing, but every time I treat patients, none of them want to go on meds chronically. No, not one of them.
That's not what my patients come to me asking, please, would you prescribe this for me? They're, most of them are, I hate medicine. That's what they come in saying. I hate doctors. I hate medicine. I don't want to have these things. They don't want to have the medical problems either, but they've not been given a satisfactory answer to as a solution other than a medication that they didn't want to go on. And because, face it, this is not what we were taught in medical school or residency. Everything that I am doing now, I didn't learn any of this in medical school or residency. I learned it in my fellowship, and also just in my studies now in private practice. A patient comes in with a problem, I have time now to go and research that until I find a satisfactory answer that isn't just the traditional Band-Aid.
And that right there is exactly the way medicine used to be before it started to get controlled for top down by insurance. And the biggest insurance was the government, right? Because a long time ago, before, people forget, like before Medicaid came out, or Medicare came out in the 60s, like you were just paid by treating the patient, and it was up to you to figure out what's wrong with that patient and treat them, whatever that meant for you, And then when Medicare came out, then you started to have the CPT codes. And with the ICD and the CPT codes, that's when they're able to say, hey, this is what we allow, so we don't allow. Certain diagnosis codes didn't even exist. I mean, a good example is like a diagnosis for sarcopenia or, muscle wasting, right? I think it was only published in like 2017. And, obviously that's been around for a long time,
I did not realize that was that recent, because it is such a huge problem.
And it's something that's been around forever, but you see, like it doesn't match because there's no big pharma interest in that yet,
Very true.
But that's amazing. And I gotta say, like, just hearing those stories, like I can only imagine, because a lot of the people that are in your area, I imagine, are there because you're in Aspen, that they're probably all interested in skiing and outdoor sports. Is that kind of the thing?
Yeah, people who actually live in Aspen, they're a whole different they're a whole different animal. You know, I grew up in the Midwest, and if we went for a bike ride, we went for a bike ride. Maybe we rode, I don't know, 10 miles. That would have been a big day. Now my patients come in, and they're riding 50 to 100 miles a day. They're skiing more than 100 days a year. Patients come into my office and they're like, "Oh, I'm sorry, just got back from a bike ride. I didn't have a chance to take a shower." And I'm like, typical Aspen. Just because everybody is so active here and they want to remain active. And, even though they're getting of a certain age, I'm of that certain age, where you start thinking, oh man, things might start breaking down. Well, I'm not willing to accept that as the status quo and as the inevitable. I want to do absolutely everything that I can to go forward, as I am now and even better. Like I said, when I first started this in 2022 was actually the beginning of the year, my health was in a major nosedive. And it was truly driven by the stress of the practice that I had. Don't have to go into the details of why it was stressful. I just didn't have help. I was in private practice and there was no end in sight for circumstances out of my control. And I found out that I was pre-diabetic. But as part of that, I had microvascular heart disease. My kidney function was in stage 3 renal insufficiency. I was overweight and was trying everything that I could do, working with a trainer, doing, being on keto diets, doing everything. Nothing was working. But when I got that blood work back and I really got hit upside the head with, your health is failing. You're literally going downhill and it's not going to get better unless you do something. You have to take the reins of your health back. And that means you can't keep doing what you're doing because the stress of what you're doing is never going to go away. You can't keep doing what you're doing and expect a different outcome. And that realization that my health was, like I said, going the wrong direction, that's when I was able to say, I love my patients, I always have, but if I'm not here, then I can take care of nobody. So exactly. If I don't start taking care of me, and nobody was going to take care of me if I wasn't going to. And by making that decision that I had to take my health, I did a 180. And, my last hemoglobin A1C is 5.0. It was 6.1 when we started. I lost 75 pounds. My microvascular heart disease is almost gone. I mean, there's minor traces of it on a very advanced EKG that I do. And my kidney function is basically back to normal. But that's kind of another thing that I would say to doctors who are thinking about this is be a good example to your patients. I was a postmenopausal woman who was having major issues. And I took control of my life and I got my health turned around. Now, I'm that inspiration. People come into me and they say, well, can this really be done? And I'm like, well, of course it can. Look, I did it. And I'm over 60. It's not like I'm 40 or 30 and that it just came off. It took hard work. But the biggest thing had to happen was I had to get rid of the stress because the cortisol was not allowing me to take control of my life.
And the thing is that the way the mainstream medical system is built is designed to do that. And if you look at the way the insurance companies deal with you, I mean, just anytime you submit anything, especially nowadays, I have some friends that take insurance, and I mean, the stuff they tell me is it's even worse than it was when I took insurance. Like every claim, they're fighting back. They want records. They want this. They want that. They want a call with somebody, and somebody totally unqualified you got to talk to. Right. And that person's going to try to call you 3 times. And if you don't answer exactly when they call you, then they're going to deny it, just all these games. Right. And it's like all that extra work and time and energy has nothing to do with the patient, nothing to do with patient care. It's just a way for the insurance not to pay. And they're happy to load you up with that because they know that if they load you up with enough, you'll just give up and then they don't have 100%. To pay anything. And so
That's exactly right. And what I love too is the way that they present it to the patient is all your doctor has to do is, do this little piece of paperwork or whatever. No, it's not. I promise you, I've been doing this for 30 years. That's not all it is. But that's what they tell the patients is it's all your doctor's fault. Your doctor just is unwilling to do this paperwork. No, that's not it at all. I'm perfectly willing to do the paperwork, but I'm not willing to fight a system. For example, Medicare is the classic example of, again, I've been fighting Medicare for 30 years. I know when the answer is 100% no, they're just not going to do it. Don't make me get on the phone for 3 hours to be told no for the 17,000th time. I know that it's going to be no. And I just don't have to deal with that at all. I mean, look at the relief, you can smile at the end of the day that you've taken care of patients and, it's not dependent on somebody else telling you what you can and can't do. I'm really here for my patients, but I'm also here for me, to have a life that, I love longevity medicine because my goal is actually to live forever. I'm banking on that we are going to reach what is called longevity escape velocity and that we will be able to, live longer than a year for every year that we live. And I'm banking on that and planning to keep myself healthy enough to get there. So I don't actually anticipate retiring anytime in the future whatsoever. When my patients come in, I'm very fortunate. I live in a very affluent area of the country. Over half of my patients do not live here, but I would say the vast majority of them have a house here. So, and to be completely honest, the vast majority of my patients have another concierge doctor, but they don't do what I do. I'm their longevity doctor. They have, say, an internal medicine doctor that will take care of the day-to-day things, but they know nothing about, the therapies that I'm doing for regeneration and longevity.
That's 100% true. I see the same on my side. A lot of people I treat, they have even multiple concierge doctors, or they're part of like a plan. Like they'll be part of like Cedar Sinai, a concierge or something like this. And then and the funny thing is all the patients will tell me like, well, they get faster responses, but it's the same thing you get if you went to the office. So, it's like we need an antibiotic or something like that. They'll get you fast. But if you have some kind of like difficult issue, they don't even try. They're just like, hey, just, they come to me or to you to actually figure out something that is needed. But I think you're completely right with longevity. And I think one of the things that a lot of people don't realize is that there's actually been a lot of case reports in medicine of people, a long, long time ago living past 200 years, like in the 1700s, there's multiple case reports of this. If you look at the Indian data, like data from India, the country, they have records of people living many hundreds of years as well in the past. And so there's been, a lot of documented stuff a long time ago that showed that people could live this long time. And then if you look, what I've seen, and I'd be curious to see what your opinion is, but like I see patients that, when I ran my large insurance-based, practice, I could see people that were 40 that looked 80. And I could see, when I did my, my concierge practice, people that are like 70 or 80 and they look like they're 40, like it's so, the age is it's highly variable on how well people take care of themselves. And then also I think how much kind of resistance they have in their lives, like how much emotional turmoil they have. It seems like the more emotional stuff that is harder on the people as well. Do you see the same thing?
Absolutely. And, what I would add to that is there are sharks that live 500 years now. This isn't something that's in the distant past. And if you look at them, there's nothing different about these sharks other than they're sharks and we're humans. But I mean, there's nothing different about these particular sharks versus other ones that would say, well, why aren't you only living 80 years? They're living 500. They're not even becoming sexually potent until 125 years old. So in our DNA, there is nothing in our DNA that says that we can't live longer and that we can't live substantially longer. We're talking, like you said, hundreds of years. I think with my population, because I do have an affluent population, there comes a point where they have pretty much everything that they could ever want in life. But if they don't have their health, and a lot of them are getting to a point where they're looking at their mortality and saying, but, I'm really not ready to go. I'm really enjoying my life now. And what we can offer them is the ability to add really healthy extra years to their life. What wouldn't they pay for that? And that's what I see.
You're 100% right. And that's a very, very great point, because a lot of times when I talk to other doctors, their whole thing is, oh, none of my patients would ever pay cash. Nobody would ever pay for that much.
They never asked them to do it.
Exactly.
You know what I say? I think that where that got brought home for me was I've been injecting Botox for 27 years now. And, when doctors say to me, well, my patients don't even want to pay their copay. And I'm like, yeah, I get that. My patients don't want to pay their copay either. But if they've ever had Botox, if they've had a breast augmentation, if they've ever had any cosmetic procedure done, they're willing to pay cash. You've just never asked them to. And you've never given them a service that was worth it. So that's, again, the take-home message is, what are you as a physician going to offer your patients that is different? Is it time with them? Is it the ability to really dive deep in their problems? Is it extra expertise? Is it extra training that you've done? And for me, focusing on longevity, I've been in this 3 years now. And at that time, there really wasn't a lot of people out there doing that. And I've seen this just grow exponentially in the last 3 years. To the point that there is even another practice trying to start up here in Aspen. My understanding is it's a little bit slow growing because they just came to Aspen out of nowhere and expected that they could just open up on a street corner and suddenly people were going to flock to them. Whereas I had been here for 18 years, I had established practice. I think that was very beneficial to me that I'd been here. I already had a very good reputation. I had a patient base already that I could grow on. And, I was a gynecologist before, but now at least 30% of my patients are men. So I do see a lot of couples. It generally starts with the wife coming in with a problem. And then she's like, well, would you see my husband? And, it's generally not the husband coming in and then bringing the wife. It's usually the wife bringing the husband in.
That seems to work all the time, though, isn't it? Because the wives are lining out the husband, get him healthy.
Yeah, exactly. Because again, if they're feeling better, they want their spouse to feel good as well.
Very true. Just out of curiosity, what do you see is kind of like for people that are interested in doing longevity medicine or doing regenerative medicine? Is there any pearls or tips that you would recommend? For a doctor who's interested in going into that field or kind of researching it?
Yeah, so it turns out that A4M, the American Academy of Anti-Aging Medicine, just this year, they are now actually offering a longevity fellowship. When I did the fellowship, it was anti-aging and regenerative medicine, and now there is a specific line for longevity medicine, because it really is looking at things slightly differently. We do work on patients' hormones. We optimize their hormones. Toxicity. If you're toxic, you're not going to live very long. So we work on getting them toxic right off the bat. That's one of the first things that we do. I started offering a lot of advanced testing that insurance isn't going to pay for. For example, I check telomere length in all of my patients. And, I tell people, look, if I know that your telomeres are getting short, I know several things about you. I know that, number one, that those cells aren't going to live very long, or they're going to turn into senescent zombie cells. And then you've got a whole nother problem. So if I know that your telomeres are short, I'm going to do everything that I can to re-lengthen them. And then I'm also going to want to kill off your zombie cells. So I can get like 2 bits of information with that. I actually do offer Rapamycin in longevity doses. I'm taking it personally and have been for over 2 years. I noticed a huge difference. And with my health, I was really scientific about this. I only changed one thing at a time and then tested and changed and tested. So along the way, I can tell you exactly what did what. And when I added Rapamycin in, I had already turned around my diabetes, pre-diabetes, and the weight was already off. But when I did my blood work after starting Rapamycin, things that were okay, my C-reactive protein was 3, it's now 0.6.
Wow.
that came from the rapamycin. My hemoglobin A1C went from 5.0 or 5.4 down to 5.0. That happened from the rapamycin. So I think what I like to tell people is be educated, get the education. Don't be just somebody that you hold a sign out and say, okay, now I'm going to do longevity medicine. I mean, I've been studying this for 13 years. I continue to study it every single day. And I'm using the advanced testing. I'm using the advanced information to make very specific recommendations for each person. There's another test called Aristotle that's a blood test that is a metabolic test. It looks at 126 different metabolites in your blood. They make a digital twin of you in the computer, and then the AI computer runs a simulation, 1,000 different simulations of what if we change diet, exercise, and supplements 1,000 different ways on your chemistry, what would happen. And what we get back is a very specific plan of, hey, you really need 200 milligrams of CoQ10. You need 500 milligrams of NR. You need to be doing cold plunging. You need to do this amount of exercise. Try this diet. So we're doing personalized medicine, very specific medicine for that person, which is, I always said, when you see the list of side effects from medications, I've always said those side effects are people who have genetic problems. They're not metabolizing that medication. And now we know that that's actually the case. So why are we waiting to do genetic testing? Shouldn't we be doing that on everybody up front so that I know that I can't give you this? If I have to give you a medication, I want to know that that's going to be the right one for you and you're not going to have a problem with it. It saves a headache down the road, for sure.
100%. And that's what I see on my side too. We have different plans. And one thing I is kind of I always try to stretch the mind for doctors that are entering it is you have to understand there's people out there, and I call it performers. So somebody who is, I treat a lot of actors and musicians, but they don't have to be an actor musician. It could be somebody who's for example, there's a guy I treat he's a bond guy. He does bonds. He issues bonds for people into the marketplace. And so he's a performer because he has to execute this thing. And there's a lot of people that do very, very well. They make a lot of money. And for them, to be down or to have any negative side effect, it would cost them hundreds of thousands, if not millions of dollars to have a problem. Where can they go in medicine right now to get treated quickly, efficiently, correctly? Cost is really not an object, but they have to get fixed now, because if they don't, it's going to cost a lot of money to them because they won't be able to do their performance, whatever that is,
Very, very true. Like you said, it's not just the performing arts. We see a lot of heads of corporations, that, and you know what I would have to say is I absolutely love my patients. When you're doing insurance-based medicine, I always love my patients then, but there was always that one or two that you're kind of like, oh man. And guess what? I don't have to do that anymore. I have a choice. It's not just my patient's choice, it's my choice. I get to choose, is this the right fit for me as well? And what a novel concept. And again, I love my patients. I love my practice. I love what I do. I never wake up and say, got to go in today. It's always, wow, what do we get to do today?
Man, that is so true. And what a change, right? Because I don't know if you see the same thing, but I'll see colleagues that I used to work at the hospital with, and I look at them and they've aged 40 years. Yeah. And I'm just like, oh my gosh. And you see their eyes and it looks dead inside. You can see they're just, they've been burned out for a decade. They're just trying to hold on till retirement. And the sad part is we know what happens in retirement. If you look at the actuary data, right? Yeah. Especially, it's 2 years after retirement, the mortality just sort of skyrocketing. Yeah. So.
Well, and the other thing to look at, because I was in that same situation, it took me 18 years to get to that very end of my rope where I said, I can't keep doing this. It's killing me. Boy, it would have been nice if 10 years ago I had gotten to that point. But what I would say to people right now is if you really are, if you're really unhappy with what you're doing, there's alternatives. Life is way too short and it is not guaranteed. None of us are guaranteed tomorrow. And I didn't want to live another day where I was regretting or worrying that, that I didn't like what I was doing. I was stressed to the max. And that is just not the case anymore at all. Life is just too short. Don't let perceived obstacles, none of these obstacles are nearly as big as what you're dealing with right now. Changing your practice, yeah, it's big, but it's nothing but for the better.
No, and I think also it's a very special time in history too, because you mentioned like 18 years ago, and I was thinking 18 years ago, so many people really believed in the mainstream healthcare system. They had so much more trust in it. After COVID, all that flipped. And I think people started waking up. They started saying, hey, a lot of this stuff doesn't make sense. I don't trust big pharma anymore. We start seeing the things that are happening in the diet and the food and just like that, the glyphosate everywhere, and you start to realize like, man, this doesn't make sense. Like there's so many things that are bad for us that are going on, and it doesn't seem like anybody is paying attention to it. And so now there's not really any patients I ever run into that are even people that are insurance based, that they're trying to use their insurance. All of them would love to go to a doctor who actually is more holistic, who doesn't use big pharma, who can actually test for things like heavy metals, glyphosate toxicity, anti-aging things. Like they don't even know where to go. But the thing is, like, if you were to ask them like, hey, if you go to an insurance doctor, would you pay cash for that insurance doctor? They say no, because the quality of care they get from the insurance doctor is so low. Why would I pay more? But if you say, hey, would you pay to figure out why you have, symptoms of irritable bowel syndrome every single day? And why when you eat, your stomach, it makes you look like you're 9 months pregnant? Well, I've been to 5 doctors. I've had 3 GI scopes and nobody can tell me anything. They just keep giving me more meds. Well, we can actually find the answer.
They tell you you're normal, or we just don't know. And here, try another doctor. But that's just not the answer. Let me just weigh in on glyphosate.
Sure.
Because I do toxicity testing on all my patients. Like I said, I insist on it when they come in. I have patients who live on organic farms, and every single one of them has high glyphosate levels. It's that pervasive in the American environment. And because people come in, they really underestimate their exposure. They underestimate their what this might be doing to them. And once you can show them in black and white, look, this is what your Roundup level is. I know you live on an organic farm, and I know you're not spraying this on your farm, but it's in the water. It's coming down in the rain. It's in the ground soil. It's everywhere, and you are exposed to this, and it's causing problems for you. I mean, data is amazing. It's why I love it, because it's irrefutable. And again, people do not have any idea that they are as toxic as they are. And I think the other thing that I would say is I see a lot of who I would call fit 40-year-old men who are pre-diabetic. These are men who are very athletic. They are not overweight. They are doing, quote, everything right. And yet their hemoglobin A1C is 5.9 and 6.0. And they are astounded that is even a possibility. And with them, I'll oftentimes have them get a continuous glucose monitor. I say, look, I want you to get this continuous glucose monitor because we have to figure out what you're doing, what is spiking your sugar. And it's been incredibly enlightening. They're coming back and they're very motivated. Once they start seeing what's spiking their sugar, they're making the right dietary changes. And the programs are so sophisticated now, you can even feed it into the AI programs and it'll tell you, it looks like this is what you should do. Try eating your protein or your fat 5 minutes before you eat your carb. And it's making all the difference in the world. But like you said, nobody was going to pay me extra for doing what I did before because it wasn't anything special. What I do now is completely and utterly different than anybody else does. And it's not something that they can find anywhere else. So that's what they're paying for. They're paying for that, the expertise, they're paying for the personalized care, they're paying for, the relationships that we have, and the fact that they can just really tell that I really care.
And also just the value. I mean, look at the return on investment. So, I mean, I'm sure you get a lot of finance guys. I have a ton of finance guys and oil and gas guys too. And they're always like ROI, return on investment. And the thing is, like, just like that, for example, you have a guy who's in his 40s, prime of his life, most of the time people in their 40s, maybe early 50s, kind of like their peak, earning time, that's when they're like the CEO or whatever, like, they're starting to get up to like their top pinnacle. And basically these guys will, like, for example, they have a high hemoglobin A1C. We know for a fact that insulin resistance is directly or inversely proportional to longevity, right? The more insulin resistance you
100%.
have, the shorter you live. And that's why if you look at longevity therapies, what do? They work on increasing insulin sensitivity, right? So, just like that, like that guy, your change, the fact that you did a CGM, you modeled it, you figured out what was wrong, you figured out how to change it, like that could have extended that guy's life like 10 to 15 years.
Right.
Maybe
And
more.
he didn't come to me sick. These people, the vast majority of my patients actually aren't coming to me sick, especially the husbands. Most of them, like I said, were drugged by their wives. But when we do the testing and we show them, hey, look, but your lifestyle is not ideal. You think you feel good now. Well, wait 10 or 20 years from now when you have your stroke, when you have your heart attack, when you have your cancer. And we're changing the trajectory of their health forever by making these manipulations now and correcting their metabolism now. I mean, again, what can be better than that?
You're exactly right. Dr. King, it's always a pleasure to talk to you. You're always so enlightening. And I've got to say, you're one of the best practitioners I've ever met in terms of holistic care, knowing exactly all the different facets of how to take care of someone, understanding the physiology. So, just an amazing physician. And thank you so much for coming on and sharing your expertise and your wisdom.
I really, really appreciate it. And thank you very much.
My pleasure. Thank you.